the pace of change is really amplified. You know what I mean? There's really, you can just see every year it gets radically different, even on the Medicare side. But a frog in a boiling pot. We were in the warm water, and it feels like every year the heat's getting turned up a little bit.
Welcome to episode 4 of the Agent Spotlight podcast. I'm going to be the host today, Matthew Gaus with National Insurance Markets, and I have with me a longtime friend, Kurt Myers of HD House Insurance.
Thanks for having
me. Welcome. Thank you for joining me. I appreciate it. So we were just kind of talking a little bit before we turned the mics on about going all the way back from whenever you started. So give me a little bit of background now, with the mics on and everything for, how you got started, even prior to working with us, just how you got started in the insurance industry.
So as far as there is no prior to working with you guys, as far as my insurance career, we've always worked with you guys. My dad and your grandfather met in the early 90s. For a long time, my dad still called National Insurance Markets Eisengarts. He would just say, "Again, call Eisengarts, call Eisengarts." I knew what he meant. I'm about 5 years older than you, so I started working with my dad when I was like 17. When I was still in high school, I would work afternoons and part-time at his office.
Yep.
Just answering phones, doing filing, making follow-up calls to people like that. And I got licensed when I was 19, when I was still in college at Penn State. And I've maintained an active insurance license since then.
Yeah.
I'll be 39 next month. So 20 years as a licensed agent. I did some odd jobs in college. I worked at a restaurant, and but really other than that has been mostly just insurance related.
Yeah.
My dad was an old life guy. It's how he got his start in life. He worked for John Hancock, and he worked for John Hancock down in Philadelphia, which is where I was born, in the mid 80s, and then moved back, started his own brokerage, which would have been right around the time that he met your grandpa.
Yeah.
Which is how we got hooked up.
Yeah.
Legacy. We didn't have a choice.
I know. I was gonna say, like, my start is fairly similar to yours, except just a little bit later. And actually, I don't even know if you know this. I didn't really even know what my parents did growing up. So they did a very good job. I will give my parents a ton of credit with that, because my parents have worked together pretty much their entire professional careers. And they did a really good job of not bringing their work home to me and my brother.
Yeah.
And so I never really knew what they did. My mom always joked that, like, we would say that, like, my dad didn't really work all the time, because that was still back whenever it was all landlines. And he'd call the house all the time, and me or my brother's answering, and it's just my dad saying, "Hey, can I talk to mom?" Blah, blah, blah.
Yeah.
And, like, he'd call all the time. Like, they're talking about work stuff all the time. But we were just like, he's just calling and talking to you all the time.
Yeah.
Like, he's not actually doing any work.
Yeah. I definitely knew what my dad did. I mean, I'm fourth generation insurance professional. So
Yeah.
my grandpa had a brokerage there, Big Erie, property and casualty guys, and
Yeah.
in Gallitzin, PA, which is right outside of Altoona, where I'm based.
Mm-hmm.
My dad went his own way with a light and stuff like that.
Yeah.
And but yeah, apparently my great grandfather did it as well.
Really? Wow.
Fourth generation.
You got me beat by one at least.
Yeah, it's pretty close though, buddy. It's pretty close. It's been a journey.
Right? It's crazy. I mean, I'm even, thinking about it for myself. I mean, you're 22 years in, essentially now, 20 years being a licensed agent. I'm at 11 years being a licensed agent. So I didn't actually get my license until after college. I started doing kind of similar to you, like odds and ends work here throughout school, throughout college, probably like my junior year in
I
particular.
remember.
That's when things started actually getting organized,
Yeah.
right?
It's crazy that we've been chit-chatting for 11 years. I mean, I've been calling and talking to your dad for 22.
Yeah, I know. I know. It's crazy how fast it goes. Every single year I'm like, oh, wow, I can't believe it's been X amount of years now at this point. Time flies, right? So so you guys started whenever you just got into it, right? Your dad started his own shop in the life insurance space in particular. Do you remember how you guys started on in the health space?
Well, he had I mean, that would have been around the same time in the early 90s when he got into doing groups, which was group major medical.
Yep.
Um, he had a pretty good book of small businesses that he wrote major medical contracts for. We had two larger car dealerships. We still have one of them. Um, but yeah, that's how he really kind of, once the protected life thing kind of went away, he got into doing the group health,
Mhm.
and that kind of took him to the Affordable Care Act,
Yeah.
which was a game changer.
Yep. That's all I know. That's whenever I came
That's when
in.
you started.
2014
Yeah.
was when I started. So all I know is Affordable Care Act.
Yeah, that was interesting. So that really hurt our business from the small group standpoint. We still have a couple on the books, but there was some big changes that we had to navigate.
Yeah.
Ah, does that answer your question?
Yeah.
What was the question?
No, you're good. You're good. But I mean, kind of just to branch off a little bit on Affordable Care, because we haven't talked a lot about that just on other episodes and everything here. Affordable Care Act was a crazy time. That also was also single-handedly the reason why I almost didn't pass my insurance test because I had a previous year's information and study guide, I guess, to go off of.
Yeah.
And all a I still remember it. A good amount of my questions were part of Affordable Care Act, and I 100% guessed on every single one of them.
Yeah, that
100%. But it changed a lot whenever it came to group and individual health insurance.
absolutely,
100%.
absolutely.
And it went from, fully underwriting everything to now it's just, everything's just guaranteed issue. Doesn't matter what your health history is, nothing.
Guaranteed
Yeah.
issue and double the price.
Yeah. Yeah.
Yeah.
Rates also significantly
Oh, yeah.
changed too.
I used to help my dad write individuals, those direct blue
Mm-hmm.
individual major medicals just right out of the book.
Yeah. We still have some of the old, like, complete care policies and things like that. And we still have some of those in our system here.
Man, that feels like 100 years.
It's amazing how quickly it now changes. Oh, right? I mean, even thinking back from 2014 to whenever I started, not even going all the way back, to whenever you were first writing at that point. But once Affordable Care Act started, I mean, it has just been
Game changer.
every single year is something else, right?
Mhm.
Because then you get the tax credit aspects coming into play. So I forget exactly what year that was now. So it could be 2017, could be 2018, somewhere around there. Um, but on the individual health insurance side, then you start having the reduced monthly premiums coming into play, all based off of people's incomes. So now you're looking at people's incomes and whatnot too, not just what's going on the health side. And then obviously you have, well, Penny then comes out. So we had Federal Marketplace in particular.
Jump to the state.
Yep. Then Penny in Pennsylvania. Now we just have our own state-based exchange, even though there are still a number of states that use the federal one. But so now we've just been using that for like 5 years now, and even still, then kind of taking it one step further, for the end of this year, there's the enhanced premium tax credit, which I mentioned on a few of our trainings and things like that, and that is set to expire at the end of this year. If that happens, the subsidy cliff portion comes back into play, which, I'm not going to get too into the weeds or anything about that, but now people who are 400% and above for the federal poverty level are still getting a big credit and a big reduced monthly premium. Well, if that expires at the end of this year, that 400%, anybody who's over that, it's done. And I mean, we've seen examples. I think you've probably actually seen the same example that I have at one of our carrier meetings, where there's an older couple, they're 64 years old, and they're at 410%. They're going from potentially paying $0 a month to like $3,200 a month for the exact same plan.
It's almost 40 grand a
It's
year.
crazy. It's crazy what could potentially happen. I mean, we have 3.5 months left for something to potentially get done, and we're talking about all the changes and stuff that can happen, and we have one staring us right down in the face on that side right now.
Yeah, and that's just under 65. What a time!
Correct.
What a time to be alive.
Hey, there's definitely going to be opportunity, though. That is for sure.
There's always opportunity with uncertainty, but
Yep,
it's also the pace of change is really amplified.
for sure.
You know what I mean? There's really you can just see every year it gets radically different.
Mm-hmm.
Even on the Medicare side. But
Yep.
it's like a frog in a boiling pot.
Uh-huh.
But I mean, we were in the warm water, and it feels like every year the heat's getting turned up a little bit.
Right. And yeah, I mean, now, we're not quite to October yet, so I'm not going to fully go into everything, but I mean, carriers are changing a lot of stuff coming up for 2026 in particular, and there's going to be a lot of work to be done on our side, on your side, as an individual agent. I mean, I'm an individual agent as well, and there's a lot going on, and there's a lot of conservation going on to try to continue kind of riding that wave that we've been doing for a little bit now, but also trying to still get new business as well. So, you're always still trying to write new business at that point. You're not just trying to, stand still, at least at this point.
Yeah, I mean, this will definitely be a retention year, to quote
Yeah.
your dad. But
Yeah. Oh, yeah. That's at least like kind of like first and foremost, just to make sure we're conserving, what we've all kind of worked so hard to build and maintain in the first place. You don't want to lose anything that you've written. It it's guaranteed to happen. Not everybody stays forever, but this is definitely one of those years that agents are going to have to be a bit more proactive and have to work a little bit harder to maintain it for sure.
we've already been working increasingly harder. But at the end of the day, people are always going to need good advice,
Correct.
which is
Exactly. And you talk about your guys' business, right? HD and Allison Insurance out in the Altoona area, been around 4 generations.
since 79. Our H.E. Allison's been open since 1979.
Yeah. So actually, coincidentally, we started in 1979.
Oh yeah,
Yeah.
yeah. My dad and his first business partners bought that from H.D. and Allison, and in like 1990,
Okay.
89, 90.
Okay.
And Dean Allison was a well-known local homeowners and auto guy. So
Okay.
most of what they bought was PNC.
Yeah. Yep.
We still have a pretty good book of
I was
that.
gonna say, yeah, you guys still do a good amount of both. Yeah, you guys aren't just a health and life insurance shop. You guys still do a ton on the property casualty stuff.
My brother and my cousin, they do the PNC, and pretty much all of it: homeowners, auto, workers' comp,
Mm-hmm.
business liability policies,
Yeah.
bonding,
Yeah.
stuff like that. But it's really night and day from what I do.
Yeah.
They're both in the insurance field, but
Mm-hmm.
and that's been good that for any one person we have, pretty much a one-stop shop. There's multiple lines of insurance that we provide.
Correct.
So
Yeah.
that makes it easier from a standpoint of being able to switch gears and put more emphasis on bringing in right now home and auto. That's our big push where we're seeming to be able to help people. In the past 7-8 years, for me, it's been the Medicare.
Yep.
So that's always been good that we have other directions that we can swim when we have to.
Yeah, absolutely. You want to be able to navigate turbulent waters, essentially. Um, Switching over to the Medicare side then in particular, right? You said you were focusing on it pretty hard over the last 7, 8 years in particular, and I definitely know that to be true. Uh, from there, do you remember when you first started selling Medicare with us?
I mean, since the beginning, man, I was writing people that were aging into Medicare for my dad's groups uh, when I started in the
Mm-hmm.
business, Freedom Blue and
Yeah.
and
Yep.
and stuff like that. I know uh, I have to give a shout out. My dad's business partner, John Vallone, he retired in 2005, right around the time that I was graduating high school, which would have been, a year or two before I'd been licensed. And he, excuse me, he kind of nudged me at that time and
Mm-hmm.
showed me the bell-shaped curve of baby boomers
Yeah.
and said, young man, if you're going to be in this business, Medicare might be something that you want to focus on.
Yeah.
Well, he retired right around the time that I was graduating high school. He's like 83 or 84 years old now. He's still rocking and rolling out there golfing and stuff.
Yeah.
He retired and he went to work for the Blair County Senior Service Center for free, volunteered basically counseling seniors on and their Medicare he did that for at least 10 years, at least until he was 75, almost 80 years old, that he was sitting down with people that were setting appointments up there and just counseling them for free on their Medicare. Well, he, in the beginning especially, was referring me a lot of Medigap business because they were writing the Advantage plans directly, but they didn't have anything for Medigap.
Okay.
So he would refer them to me. I would talk to the people, and I had a lot of cases writing a lot of Medigap. But
Yeah. Yeah. That's great. You still talk to him all much?
oh yeah, I just saw him like 2 weeks ago. He's still out there golfing and loving life.
Yeah. That's awesome. He was definitely thinking ahead at that point because that would have been right at the beginning of the whole baby boomer boom, for lack of a better way to put it.
Oh yeah.
And crazy thing is now whenever you look back on it, 2030 is the end of it. So we're actually now, in the final kind of stages, last 5 years of that entire boom now, which is wild.
Yeah, I know my parents are on the younger side of it. My mom just turned 65 last month.
Yep.
And my dad will turn 65 in February.
Yeah.
So I told them I knew a guy.
We'll see if that guy gets a call.
I hope they don't. I hope they don't go direct because that would really be telling.
Oh gosh, I might have to send out a quick little call or something and be like, "Hey."
I'd rather you write it than anybody else, but if I, you know what I mean? If I can't write it, I'd rather you
Right.
have it. But I would probably ask you for a referral at that point.
I can do that. I can make sure.
We'll work something.
Yeah, exactly. Not a problem. That's too funny. Hopefully they call you.
I think they will.
It does happen though. Like I know there's like, "Oh, well, we just didn't want to bother you for X, Y, or Z thing," right? And then next thing you know, you're untangling a web of whatever happened, trying to make sure that this, that, or the other is now working correctly,
Yeah.
whether it's a doctor or a prescription and things like that. Those are things that, you're out there every single day, right? So this isn't even necessarily just with your parents, but like you see this stuff all the time, right? You see it on the client side. I see it a little bit on the client side, also just from the agent
I
perspective
mean,
too.
you're seeing it on the client
And
side because when I have issues, the first thing I do is pick up the phone and call you or your dad. So it's been, especially getting into the D-SNPs, the Medicare and Medicaid stuff is just a lot more Interesting.
Hmm. Yeah, I mean, it's a different market. It absolutely is. I mean, there's a number. The funny thing is, right? Whenever some people think about Medicare, like you just think older generation, right? You don't really know that there's a whole different world within Medicare
Mm.
as well. And there's so many different avenues and aspects to it, whether it's, just people turning 65 whenever it's their first eligibility. That's the big one that like everybody knows. But from there, right, you have all the different enrollment periods when somebody can actually enroll and change their plan. We're coming up on a big one here in the next couple weeks with the annual enrollment period. So for anybody that's listening, if you are in that time period, October 15th or December 7th, call your agent, call Kurt. He'll make sure to get you on a plan that's going to end up working for you.
The schedule's
Um,
filling up fast.
so, but you have all the different enrollment periods. Then, you have different buckets of when people could potentially lose coverage or whenever, speaking of Medicare, Medigap and Medicare supplements, you know, they start getting those age rate increases after age 68 or 69. So then they're kind of starting to look around a little bit more because now they're kind of getting hit in a different way with their rate instead of the regular just annual rate increase that comes along.
For sure.
Not to mention you have just standalone prescription drug plans that somebody has to get because, a Medicare supplement plan doesn't cover prescriptions.
Yeah, that's a real task to explain to somebody, what their options are with Medigap and standalone PDP or going with an Advantage plan.
Yeah.
And that's a lot of, just getting back to John Valone, that's a lot of what I still use when I sit down with a new prospect is, hey, I just draw a T on the middle of the page and I say, Medicare Advantage,
Yep.
Medigap PDP,
Yep.
this is what's different.
Yep.
And it's sort of like a fact finding to find out, what any individual's flavor is for that.
Absolutely, because it is absolutely not one size fits all. Like, Medicare is not one size fits all in any shape or form. Every single person's needs are different. And I mean, I just had this prime example last week on Friday, when I was talking to a husband and wife, and they're going with two different carriers and two different plans because that's just the way that it was gonna need to be set up
Oh, I've
for
got
them
yeah.
in to save them the most amount of money as well. It was, and everybody thinks about it, right? The husband and wife is like, "All right, we're just gonna go in, we're gonna get this thing, whatever it is," because they didn't really know anything coming into it. And the very first question that I get is, "Well, why wouldn't I get the same question as him?" It's like, all right, well, we're gonna go through all that, but this is why. And by the end, we're like, okay, that makes sense. I can completely understand, why we wouldn't want to be on the exact same plane, at least for the remainder of this year.
Yeah, it used to surprise me to find how little intelligent people knew about Medicare.
Yeah.
Because if you figure, somebody that's turned 65 and retiring, they have worked for a company most likely their whole life. So their insurance has been spoon fed to them through their corporation or through whoever they're working for. And then they get to retirement and, if they did it right, their healthcare is really, it gets that ball gets checked to them
Hmm.
at retirement.
Yeah.
And it surprises you, you know, that people, they don't know what to do.
No.
They really are looking at it for an education in it
Absolutely.
and for somebody that knows about it. And at the same time, that's really, if they did it right when they retire, that's one of the last things that they really have to take care of is their health care. A lot of these people, their houses, their cars are paid off.
Yeah.
They're trying to
Correct.
get into those golden years
Yep.
where they don't have to worry too much about it, but
Yep.
the
What
changes are coming.
And that's the role of, someone like you and someone like your guys' business and everything is to be there for every single one of these people. to guide them through that entire process. I mean, I know I talk about this all the time, and I talk to our agents about it. I talk to the clients about it, whether it's a seasoned agent, new agent, doesn't matter. It's like, it is all about the education.
Mm.
It is all about the education because just like you were saying, people don't know what to do. They just don't know what to do. And it's plain and simple. They don't. And it's huge for like the individual agents like yourself to go out there and explain the process to somebody because they don't know where to start.
Oh,
And we've seen it, time and time again. You've seen it time and time again where somebody's went on their own and either A, it gets delayed far enough, the can gets kicked down the road for too long, so it's maybe a late enrollment penalty, and then also on top that, like, maybe their doctor's now not covered or now a prescription's not gonna show up on there. So they're trying to figure out what to do. And now also maybe they're not in an enrollment period that they can make a change. So the role of that individual agent and broker is absolutely paramount to making sure that they get where they need to be when they need to be there. Whether that's them, retiring at age 62 and bringing them all the way to Medicare at age 65, or if they retire at age 65 and they need that transition from the employer plan, like you mentioned, because most people don't have that, say, like federal retiree program that they can just slide right on into and use that forever.
yeah. I mean, by that token, sitting down with somebody and counseling them is really a good part of the job. And the hard part is finding people to do that for.
hmm
That's the real work, is finding people
Yeah,
to counsel.
I agree.
But it really is a counseling session. And I know more about Medicare than 99% of the people that I sit down with that are going to be on it.
hmm
So just explaining that to people, and if you do it in a way where you're educating them and finding out, like I said earlier, what their flavor is,
Yep.
then the plan and the sale is a byproduct of all that.
Correct. It's not really a sale,
No.
in my opinion. No. I completely agree with you. That's just kind of the thing that happens at the end of
Hmm.
at least like the initial.
At the end of the conversation, yeah.
Mm-hmm. Like that.
Especially for regular Medicare turning 65 people. Like we talked about, the dual special needs people, the Medicare and Medicaid people are a different beast,
Yeah, for sure.
but are a bird of a different feather. But it, you know, the real good that you can do is when you sit down with folks that are turning 65, that have been working for the company their whole life, that now have this really problem that they're faced with, which is they have to do something. They have to take control of their own healthcare now.
Yep.
And it's daunting for them.
When they have to make a decision on something, it's not necessarily how, say, kind of circling it back to life insurance, right? Life insurance to some people is just a nice to have.
Mhm.
They don't, not everybody views it as something that they need to have. Yeah. So we were talking about, different enrollment platforms and things like that. So we've been using Connector for 2 years now. We were using another one previously. Um, Fun fact, I'm not sure if you know about this or not, but the previous company we were using just decided they weren't going to pursue them using it anymore,
Is
essentially.
that the same company
And
that was doing the recording software and the
they were, no, so that Ring Central.
Yeah, I still use that.
Yeah. No, so they used Ring Central as like a third party company to connect in for the call recording.
What was the
But
company
from
called
there,
that we were
it was
doing?
Trusty Care.
Trusty Care.
Yeah.
Okay.
And they were great to work with. They were our first like venture into like the electronic enrollments and like an aggregator, probably similar to like you guys have on the property and casualty side.
Easy Links.
There we go.
The product that we use.
There we go. So, but whenever we moved over to Connecture, we found out that AEP, that Trusty Care was going to be done at the end of December. So I had like 60 days essentially to actually probably less than that, to be like, all right, we're moving on from this. We need to get something else in place.
You're getting pretty used to
And
that time, aren't you?
and now we had it in place. It took a little bit of time to get everybody actually like moved over and whatnot. But Connecture and Sunfire were the two that we were going to be looking at. We ultimately decided on Connecture because that's what Trusty Care used for the actual quoting and enrollment. So they had everybody's information, and we were going to be able to transition everybody's information over to that platform. So that was the most easy and seamless transition for us whenever we were
I had to
making
do that
change.
I had to do that with all my recordings, is to basically have them imported from Ring Central back into Ring Central.
Yeah.
And I kept my same phone number and everything, but it was just one into one, just because of that relationship ending with Trusty Care.
Yep. And they were great. I mean, I've still talked to a few of them every so often. I don't know exactly. They've actually, Trusty Care is now like rebranded into something else. They're doing a completely like new thing now at this point.
Quite understand what was going on there, but that girl did help me get it all transferred over. I forget her name.
Yeah. I mean, that was a crazy time. Her name was Allison.
Allison, yeah.
Her name was Allison.
It was a crazy time. It's still pretty crazy.
It is. You're right. I mean, there's definitely a lot going on. We have noticed though, like everybody using Connecture, like once we finally, get them going, now like new agents, it's just, this is what you do type of thing. But it did take a while for us to, get everybody kind of moved on over. And we're, at least on the Medicare Advantage and the prescription drug side, because most of the carriers now want electronic enrollments, like you've mentioned. Most everybody is now either utilizing that or is using direct to the carrier portal. So we've gotten pretty much everybody moved away from the paper apps now.
That's a whole nother ball of wax. Is if you represent 5 carriers, and that's 5 portals that you need to be working and using, and then it can get to be like, a little bit much.
Yeah. That's why, we've been such a huge advocate of using something like that. One, because, we pay for it. It's free for you guys to use. So it's not like you're actually paying to utilize it or anything. But the time savings is
I'm sure, especially for you guys and processing apps and stuff like that. And really, once you learn, I mean, my being old school and being from, an old school upbringing in this is like, I got to get a signature. You know what I mean? I have to get a signature. I have to physically send this to National Insurance Market, so it's not real. And there was really a couple month period there where I would click submit on these electronic apps and be like, it's in the ether now. It's somewhere in the ether.
right. Good news is we have not had a single lost application from it.
No, it's been
Not
good.
one.
It's been good.
Yeah.
It's been a time saver, I'm sure, especially for you guys.
Oh, yeah.
Even for me.
Oh, yeah.
I mean, I still am taking enrollment packets to people. I'm just not filling out the application in the back of it, typing it into the computer, which makes it a little bit more interesting, especially when you get out into some of the more remote areas where I live and there's no internet access. You're like, wait a minute, I'm not going to be able to connect to my hotspot here to do this application. I'm going to have to get Starlink or something like that.
Right.
But yeah, there's still, believe it or not, places out there without
I know.
connection.
Pennsylvania's a crazy state whenever it comes to that because, I mean, we have Pittsburgh. That's where we're at.
Yeah.
Pretty medium-sized city. It's not a large city.
Yeah.
But it's still a good size. You have Erie, which is all the way in the northwest, smaller than Pittsburgh, but still a metropolitan type area. And then, I mean, everybody knows Philly, top 5 or 6 in terms of population in the entire country. But once you kind of get an hour to an hour and a half outside of each of those, it is very, very rural.
Yeah, that's basically where I'm at. And
Yeah.
and the Laurel Highlands, which is honestly just probably you have Altoona and Harrisburg and you have State College. And other than that, it's just a web of interconnected small communities in these counties. I mean, Bedford's tiny. Bedford and Evansburg are about the same size, I would say, but they're just tiny little county seats. And with Johnstown's about the size of Altoona. But other than that, it's just hamlet after hamlet, little tiny little place that one stoplight, you drive through it. And
Right. Yeah.
if somebody needs something, they're just going to the next closest place that is big enough to have a Walmart.
Yeah.
And,
It could be 30 minutes away.
yeah, yeah. And they don't mind. They're used to it.
Yeah. We don't think about it. Like where I live, I have Walmart, Shop and Save, Lowe's, Giant Eagle, Aldi within less than 5 minutes of where I live.
If you live in a place like Northern Cambria, then you're driving 30 minutes to Evansburg or Johnstown, either way that you decide to go to a Walmart or to go to your doctor.
Yeah.
And that's a large part of the area that I live in, which is between 2 hours east of Pittsburgh and about 3 hours west of Philadelphia.
Yeah. Yeah. You're almost smack dab right in the middle there.
Yeah, right where 99 meets 22. It's really, really, truly right in the middle of a lot of, bigger cities.
Yeah. And that's where, like, you've been able to travel, like, you've done a lot of in-person appointments over the years.
Hundreds and hundreds.
You've done a ton of them, and, you've been in every single house. You know what everything looks like. You've been there, done that. That is for sure. Nice thing is, with kind of relating that to something like Connecture, and you don't always have to do that now, which is awesome. You don't always have to make the 1.5 or 2 hour drive to see everybody. Not that like you're moving fully away from something like that, because you love the face-to-face interaction in general and having that connection to somebody.
I feel like that.
Which there is absolutely something to be said for it.
Yeah, for sure.
The nice thing, at least now for you, is that you have options.
Yeah. As long as I'm in this business, I do feel like I will always make the extra effort to see people. Now, if I need to apply that technology like Connecture to it on my end, that's one thing. But people that are getting onto Medicare, by and large, benefit greatly from sitting down with somebody and talking face to face.
And you're like, it's weird to say almost, but your 65-year-old is different than the one that's like around here, for the most part.
For sure. But I think too that one of the main things that you hear when you talk to any Medicare prospect anywhere is, I get so many calls, I get so much mail. You're really cutting through a lot of red tape if you're sitting down with someone.
Oh, if you're sitting down with somebody, if you see somebody face to face and you're actually sitting down with someone, that application's yours. It's not going to someone else.
For sure. Which is why I've always made the extra effort. That's one thing that my dad always told me, no matter what line of business you're writing, is see the people.
Yeah.
Go see these people.
And they appreciate it.
Yeah, it's important. I mean, I have people that I go back and see every year for a sit down, and, they give me hugs. They remember my kid's name. You know what I mean?
Yep.
They appreciate that.
Yep. I mean, I have it now. I mean, great, like, you're one of the agents, like, I recently had a kid, my wife and I, 4 months old next week, and, every time that you're calling in, you're like, "How's the baby?
Yeah.
How's the baby? How's that?
I mean,
How's this? How's that?"
that's what's important.
Like, it's not just business, all the time. It's nice, walking into someone's house, they remember you and everything, and they're asking, how the kids are and all that type of stuff. And that at that point too, like, that person's not leaving you either.
Yeah, that's something that I definitely try to incorporate is just like to ask about pictures that they have hanging on. Oh, are those your grandkids? Oh, I have kids too. Let me show you a picture of my girl. So
Yeah.
you you build rapport with people, and you can't do that over the phone. You can't.
It's not the same, that's for
No.
sure. It is definitely not the same. No, 100%. 100%. No, I completely agree with you there. No doubt in my mind.
That's a large part of rapport building that I think will really tell in your retention.
Yeah. Well, and I think we see that, maybe not as much necessarily like on our client side because, we're not doing the exact same thing that all of our agents are doing all the time, right? Because we are focused on supporting our agents, but we see that on the agent side, like we're here to support our agents, and we have so many agents that have worked with us for a long time, whether that's them starting for 5 years, but like you've been here for 20. We've had other people on here that have been 20, 25 years, 10 years, 15 years.
The larger relationship between my company and yours is over 30 years.
Yeah. Yeah, exactly. So like we see it on the retention side, like with agents, like for the most part, when an agent starts working with us, like they don't really leave. Like there's generally, I mean, don't get me wrong, we're not 100%, but for the most part, it's pretty few and far between that, when an agent starts working with us, whether that's them already have been in the business previously and coming in to work with us, or us training them from the very beginning. There's very few times that an agent leaves to go somewhere else.
Oh, I never would. I can't imagine. You guys are so entwined with what I do that I can't imagine how I would even do it. You know what I mean? The first thing I do is pick up the phone and call you guys. I honestly get to the point where I'm like, they're probably sick. Are. Because I'm calling to talk to you or your dad or Ruth or your mom or somebody.
Uh-huh.
Someone's going to hear what I had to say and offer me advice. I can't do this alone.
Well, it's funny too, because we do have agents that like because like, hey, they want to talk. Someone's like, all right, someone's on the line. All right, is Ruth available? Oh, I'm on the line. Okay, is Mike available? Oh, nope, they're all on the line. And then everyone's like, what do I do?
Yeah.
Everyone's busy.
Leave a voicemail.
They will call you back.
Yeah. Usually you guys call back within 20 minutes. So,
Like we will call you back.
yeah. Pretty quick too.
And that is something that we've always been, talking about go and see someone, but it's like, we want to make sure like we are there for them. Like we are there for you guys. We are there for the agent.
I feel like you and my dad, or you and your dad, are like counselors for me. Like mental health. I just need to call in and just state something. Like I didn't know what else to do. I
just called you guys.
yeah.
I mean, people do that to Ruth. I know
Yeah.
that,
Ruth's the same way.
right? It is funny how that happens though. But I mean, that's what happens too whenever, you're comfortable talking with somebody, you're comfortable working with them. Like it's not again just full like business all the time. Like you can work through things and make sure that everything's, the way that you want it to be.
You have to. Yeah. You have to. And it's
Yeah.
not just that I like you guys personally. It's that the education, the support is honestly instrumental to any success that I've had.
That's awesome to hear. And, I mean, hey, we're 20 years into it. No plans on stopping anytime soon.
20 more. That would put me at about 58.
You're gonna retire at that point.
I would like to. I don't think I can do this forever.
We'll put at that point, me and you were gonna be on a golf course.
Yeah, why didn't we think to start like at the enrollment platform? We could have started our out.
We should have started Connecture or Sunfire or something.
That would have been the move.
Maybe next time.
Yeah, next time for sure.
But that's a great place to end it, I think.
Thank you.
I appreciate you coming on. I really do.
Thanks
It's
for
been a
having
pleasure working with you, and
Absolutely.
looking forward to many more at this point.
Thanks, pal. Enjoy that baby.
Yep, will do.